Edwina, the new genomic consent form mentions that test results may identify unexpected family relationships. And it'd be good to have your thoughts on this as a genetic counsellor.
Sure.
Yeah. So what does it mean? Is it about misattributed paternity?
Well, misattributed paternity would certainly be the most common unexpected family relationship that you'd identify on testing. Misattributed paternity is also known as non-paternity, but the sentence has been kept general because it is possible to identify other unexpected family relationships, in particular if you're testing several family members across different generations.
So would you bring this in when you're consenting an individual or family for testing?
Yes, it's brought up before testing when you're going through the consent discussion, and it is actually a fairly standard item to have on a genetic or genomic testing consent form. It can be easy to forget to mention this, and when it's on the consent form it also acts as a prompt or reminder to the health professional to bring this up.
Why raise this before testing and rather than waiting until the results come out?
Well, if unexpected parentage does come up in the results, and if the patient hasn't been given a heads up beforehand, then I think we can all imagine that could create some serious disharmony within a family. And also, if you do mention this as a possibility of coming up beforehand, then it does give patients the option of deferring or declining testing, or they may even contact you and ask for some advice about the testing approach.
So when do you think they're most likely to be picked up, these unexpected family relationships?
It's most likely to come up if you're testing a child with their parents at the same time, and we call this trio testing. It's a fairly common testing approach with exome and genome sequencing. Or if you have already tested a child and are then proceeding to test the parents for whatever variant or variants were identified in the child. But this can come up in many different scenarios. It might be in a prenatal testing situation, it might be in a paediatric setting, as I've just given you some examples of, or in an adult testing scenario. Once you start testing several family members, then that raises a little flag for me that I need to remember to start to make sure I'm mentioning this to families.
Yeah. Would you say it's a new issue for genomic testing? I feel like it's always been a part of the genetic counselling conversation.
Unexpected family relationships can be picked up on tests that have been around for years, as well as the newer genomic tests. So this has always been a consideration for genetic health professionals. I guess some factors with the newer genomic testing is that you're getting a lot more information from the results, and also you may be more likely to be testing the trio, the three individuals at once.
I guess how would you explain this to your patients then?
I think we all explain this in different ways, but it may be easiest just to use the words of the consent form. The test results may identify unexpected family relationships, and then you could give an example that results could tell you that a parent is not really a biological parent. But I think this can just be mentioned, quite quickly as you go through the consent form.
Yeah, thanks Edwina, it's so helpful.
Oh, great.